It's been confirmed tonight that President Bush has finally decided on a plan to offer the smallpox vaccine to millions of Americans. The official announcement is expected Friday. This is a deadly gamble. This country stopped giving mandatory smallpox vaccinations 30 years ago. Soon after that, doctors eradicated the disease from the planet. But now the government has decided to bring back the vaccine because of fears that terrorists or some state such as Iraq could take the deadly virus out of a freezer and use it as a weapon. We may have forgotten, but smallpox was or is a terrible virulent disease. It kills 1 out of every 3 of its victims. There is no cure. The vaccine effectively immunizes against smallpox, but that protection has a price. Some people die from it, and others have serious bad reactions, some permanent. Scientists say it's the most dangerous vaccine known to man. It could protect Americans from the unthinkable destruction of a smallpox attack, but make no mistake, it is a vaccine with a dark side.
We know that if we immunize 1 million people, that there will be 15 people that will suffer a severe permanent adverse outcome and 1 person who may die from the vaccine.
Dr. Paul Offit is one of the country's top infectious disease specialists, and he knows all about vaccines that prevent those diseases. In his lab at Children's Hospital of Philadelphia, they study and create new cutting-edge vaccines. But there's nothing new about the smallpox vaccine.
The smallpox vaccine was created by a man named Edward Jenner in 1796, and so we've had essentially that vaccine for 200 years.
The same vaccine primarily?
It's essentially the same vaccine. We tend to think of vaccines as being very safe and very effective, which they are. But all the vaccines that we use today are the result of modern technology. That's not true of the smallpox vaccine. The smallpox vaccine has a side effect profile, frankly, that we would not accept for vaccines today.
In case your high school biology is a little rusty, smallpox is a contagious virus that has plagued mankind for thousands of years. It was officially eradicated in 1980. In the century before that, smallpox killed 500 million people worldwide and scarred hundreds of millions more. The smallpox vaccine is made from a weak biological cousin of the smallpox virus. When you get vaccinated with the much weaker virus, as millions of Americans were in the 20th century, you become immune to the very strong and deadly smallpox virus. But once in a while, the vaccine does more harm than good. Dr. Offit showed us what he calls the side effects profile of the smallpox vaccine, and we should warn you that it is grim.
When one gets the vaccine virus here, it's because it's so itchy that you can't help but try and scratch. And if you then touch areas like your eye or other areas, you can accidentally implant the virus there. And that's very common. That occurs in probably about 500 for every million that get the vaccine.
So if you scratch where the smallpox is at the surface, and you put it to the eye, this is what happens.
That's what can happen.
Well, I can barely stand to look at these pictures, but what else?
Okay, then this is something called generalized vaccinia, and it occurs in about 200 people for every million that get vaccinated, and it's generally benign. Then this, which probably doesn't look as bad as the previous pictures, is actually the worst thing that can happen. This is called progressive vaccinia. When you get the vaccine, if your immune system is compromised, the virus just continues to grow and grow and grow, and is often a cause of death.
No one is certain just how many people will be hurt by the vaccine. A landmark 1969 study found that 74 people will suffer complications and at least 1 will die out of every million who are vaccinated. These side effects were never a secret, but they were rarely discussed. Massachusetts first required smallpox vaccination in 1810. And many other states soon passed laws requiring every child to get inoculated before starting school.
Is the risk of taking the vaccine any greater today than it was when I was beginning elementary school?
Certainly the side effect profile of the vaccine, I think, is the same today as it was when you were attending elementary school. But what's changed is that when you were attending elementary school, there still was a risk of disease. Therefore, the benefits of that vaccine, I think, did outweigh its risks.
There was a time not long ago that people just They'd suck it up and say, listen, if I need to get a shot, I get it.
My parents, who were children in the 20s and 30s, they saw diphtheria, they saw polio, they saw the plagues that devastated children in this country. And so the notion of getting vaccines was nothing.
If you did get the smallpox vaccine as a child, it could help you today. Some experts believe you may still have some of your old immunity against the disease. But that's just a theory. There are no reliable studies on this, and other scientists disagree. So why would your government recommend a vaccine that could kill people? Because the disease it prevents is worse, much worse.
It is the worst human disease. It probably killed more people in history than any other infectious agent, including the Black Death of the Middle Ages.
Richard Preston writes about deadly diseases like Ebola and anthrax, but nothing scares him like smallpox. He's just written a book called The Demon in the Freezer, about how the smallpox virus has been turned into a weapon of mass destruction.
Smallpox as a weapon is the biological equivalent of the nuclear bomb. It is simply the most dangerous biological weapon in the world.
And smallpox is one of the things the UN weapons inspectors are now looking for in Iraq, a country most experts believe had and may still have a weaponized form of smallpox.
It could easily be that Iraq is in possession of military strains of smallpox. A military strain would be a type of smallpox that might be resistant to the vaccine. It might have a higher fatality rate in humans. It might create a more pronounced disease in humans.
Just how contagious is smallpox?
There is a very heated debate going on in the scientific community right now about such things as, for each victim of smallpox, how many people are going to catch it from that victim? That's known as the multiplier of a virus. If the multiplier of smallpox is 10, that is to say, if each person infected with smallpox on average gives it to another 10 people, then a smallpox outbreak will be explosive in our society.
The multiplier was much higher than 10 in a small town in Germany called Machete in 1970. One man was hospitalized with the disease and kept in a hospital isolation ward, but 19 hospital staff and patients who never saw the man got smallpox. Still, doctors were able to control that German outbreak by vaccinating the people around the victim, a process known as ring vaccination.
We know how to put a ring around the infection to contain it. You identify a person who's infected, you quarantine them, you isolate their contacts and then contacts of those contacts, and that eliminated smallpox from the face of the earth.
Which is why Offit thinks it's a mistake to vaccinate lots of people now before there's any kind of outbreak. He thinks there's a safer approach.
Here's another way to do it. We can make the vaccine, make sure we understand who's going to get it, who's going to be giving it, and then wait. Wait for there to be one case of documented smallpox somewhere on the face of this earth. And then we can move quickly into vaccinating people, large numbers of people.
Be cautious. Vaccinate only a few people unless and until there's an outbreak. That's what many public health specialists who worry about vaccine side effects believe. But others are more fearful of a smallpox attack.
You see very good physicians arguing very hard that smallpox is really not a problem and that can easily be handled. These doctors are maintaining an excellent bedside manner with the American people, but they don't fully inspire confidence in me. This is an awful lot of human effort that's gone into the design and production of such weapons as smallpox. They take it very seriously, the weaponeers do, and therefore we need to take it very seriously too.
Israel takes the threat of a smallpox attack very seriously. In August, they immunized nearly 15,000 healthcare workers. More vaccinations there are planned. So far, there have been 4 bad reactions, 2 very serious, and some healthcare workers are unwilling to be vaccinated. At Minnesota's Mayo Clinic, Dr. Gregory Poland is conducting one of the only scientific studies of the vaccine. His staff started inoculating volunteers just a few weeks ago. one of Dr. Poland's major concerns is making sure people don't spread the vaccine virus to other people who haven't been vaccinated and shouldn't be.
What if a child touches it? A pregnant woman, somebody with HIV infection? They could potentially die as a result.
The New York City Health Department is one of the places where all the talk about vaccination turns into reality. New York's health department and health departments in every state have developed plans that outline who should get inoculated and when.
I think the general principle that we're following, since this is a preparatory phase, is to err on the side of safety, to make sure that since we're doing this to prepare for a possible event, not to respond to an actual event, above all, do no harm.
Dr. Thomas Frieden, the New York City Health Commissioner, estimates his department alone will have to vaccinate 15,000 New Yorkers very soon, and perhaps 300,000 more in coming months.
Doctor, you have children?
Yes.
Would you have any hesitation that they get the vaccine?
We're not recommending at this point that children get the vaccine. The vaccine is not for the general public. It's only for those people who would be, in the case of a smallpox outbreak, would be responding to and caring for the initial cases.
The first to be vaccinated, Dr. Frieden says, will be a team of healthcare workers at each hospital in New York. But some people should not be vaccinated.
Some of the people who shouldn't get the smallpox vaccine are those who have a weakened immune system, including those who are HIV positive, those who have gotten cancer treatment, and those who have a transplant.
Also included on the no vaccine list are people with the skin condition eczema, pregnant women, and infants. Dr. Frieden's department has real-life experience with large-scale vaccination programs. More than 50 years ago, a tourist brought smallpox virus to New York City, and health officials reacted quickly.
More than 6 million people were vaccinated in just 3 weeks in New York City in 1947. There were 12 cases of smallpox. There were 2 deaths associated with smallpox, and there were, I'm sorry to say, 3 deaths associated with the vaccine.
Well, I can hear someone responding to television saying, wait a minute, this doctor just said in 1947 that they had 2 deaths from smallpox and they had 3 deaths from the vaccine. So why is he telling me it's a good idea to get ready to vaccinate people now?
Because if they hadn't vaccinated, they might have had thousands upon thousands of deaths from smallpox.
It all comes down to a question of odds. Scientists know what the risks are for the vaccine, but no one knows, or is willing to say, what the chances are of an actual smallpox bioterror attack. That leaves us with a dangerous gamble.
What are the chances of panic, given that most people haven't even been thinking about smallpox until fairly recently?
Well, the good news is the government's been thinking about it, and the government has put a lot of money forward to try and make enough vaccines so that we can immunize every man, woman, and child in this country.
Can we do that at this moment?
We will have enough vaccine to immunize everybody by the middle of next year.
For accuracy and context, we emphasize that President Bush's smallpox vaccination plan, which is expected to be announced Friday, will focus first on medical personnel and emergency workers and offer the vaccine on a voluntary basis to the general public later on.